Mental health literacy is the knowledge and understanding of mental health. Mental health literacy programs teach people how to recognize signs and symptoms of mental illness, how to manage symptoms, and where to seek more formal help.
Teaching young people or those who regularly interact with them to recognize internalizing symptoms such as depression and anxiety could be beneficial to reduce the gap between the number of people experiencing mental distress and those who seek treatment.
We explored programs aiming to improve the recognition of depression and anxiety in young people and to seek help for these symptoms. We used a systematic approach to identify relevant studies, finding 17 that fit our research criteria.
These programs were either universal, targeting all young people, or were specific, targeting those with symptoms. Programs were delivered in schools by teachers, mental health experts, a mix of both, peers, or were accessed online.
Teacher-led programs enhance knowledge about depression and anxiety, whereas the expert-led programs were clearer at reducing the stigma associated with mental health issues.
None of these studies were from low-income countries. Because we think mental health literacy programs could be valuable in low-resource settings, we spoke to young people and stakeholders from Nepal, Colombia, and East London.
Young people said they valued learning about mental health and believe it should start earlier.
Many also highlighted stigma as a major barrier to delivering such programs.
In summary, mental health literacy programs can reduce the healthcare burden of emotional difficulties in young people, but we need to standardize some of these programs and the scientific methods used to test them. We also need to assess their value in low-resource settings.